Hello. Hi. I'm Dr. Tracy Paschke. Had a few technical difficulties, but I overcame those, so I'm happy to be here with you. I'm a cardiologist, and my company is Heart Health Prevention and Wellness. And my purpose with heart health is to help people prevent and reverse heart disease. So um, this Q&A is to help people become a little more acquainted with heart disease, what it is, how it affects us, and how to prevent it, because ultimately that's what my goal in all this is to help people prevent and reverse heart disease. So this will be a Q&A. So if anybody has any questions, feel free to ask them, and hopefully I'll see them and I can answer them. And while we're waiting for other people to join and for the questions to pop up, I'll probably just chat about some different things that I think are helpful for people to know about heart disease. So importantly, heart disease is the #1 killer of men and women in the world. A lot of women don't realize that heart disease is the #1 killer of women, but it is. So it's very important that we sort of keep that top of mind. And we don't want to get depressed or upset about that. We need to use that to empower ourselves to make healthier choices, right? So to make decisions that help us prevent heart disease. So knowing that heart disease is the #1 killer of men and women, what can we do to combat that? So, it's a lot of people have a family history of heart disease, and certainly genetic factors play a role, but only a very small percentage of heart disease is genetic. So the rest is lifestyle. And so lifestyle is, that's something we can change. We can't change our genetics yet anyway, but we can certainly work on our lifestyle. So that knowing that empowers us to make changes, not just that we're kind of stuck with the genetics that we were dealt and we're doomed to, die of heart disease in our 50s like our dad did maybe. It doesn't have to be that way. So that's important to know. So then if we know that heart disease can be prevented, what are some things that we can do to prevent it? So I rely on the American Heart Association. They have what they call Life's Essential 8, and you can Google that. Basically, it's 8 things that we should pay attention to help prevent heart disease. So one is eat better. So this is a big thing, in the United States. Most people eat what we call the SAD diet, the standard American diet, SAD diet. It's unfortunately not very healthy. It's full of processed foods and fat, the bad kind of fat, and calories, and it's not very healthy. And unfortunately, it's causing a lot of problems, right? So more Americans have chronic diseases than ever before, diseases like metabolic syndrome and diabetes, obesity. So these are important chronic diseases related to diet, and then these are related to heart disease, right? So there's a very strong association with diabetes is a very strong risk factor for heart disease. So all these things are related. Their second pillar is be more active. So again, in modern society, we're not as active and we sit a lot. So it's reminding us to be more active. So the current recommendation on that is 150 minutes of moderate intensity exercise every week. So like a brisk walk, or, walking on the treadmill or a stationary bike, something to get you moving. It's also important if you sit a lot at your work or during the day, to try to take breaks where you get up and move around, do some stretches, or try to do some jumping jacks, something to get you going, and try to incorporate that into your day. The third pillar is quit tobacco. So certainly, surely everybody by now knows that smoking's not good for us. So if you do smoke, it's recommended that you stop smoking. A lot of people are vaping instead of smoking. That's not healthy either. It's maybe better than smoking, but I recommend to my patients to use that as a bridge to stop smoking. And then, the latest data on smoking marijuana doesn't look like it's going to be very good for the heart, which probably isn't too surprising. So keep your eye out for that. But certainly smoking cigarettes is not good for you. The next pillar is get healthy sleep. So we're learning more and more that sleep is important. And it's not just, most Americans don't get enough sleep, and they don't get good quality sleep. So the recommendation is 7 to 9 hours of good sleep every night. Sleep is good for our health in so many ways. Sleep is when our brain sort of cleanses itself. And so it's very important. The next pillar is manage weight. So, it's important to maintain a healthy body weight. We know that people who are overweight have more risk for metabolic syndrome and diabetes, and those are risk factors for heart disease. So, it's important to maintain a healthy weight. You've seen recently a lot of in the news about the new weight loss drugs, and certainly those drugs are helping people lose significant amounts of weight, which is a good thing. There recent studies show that when people stop taking those drugs, and I'm talking about drugs like Ozempic and semaglutide, when people stop taking those drugs, they gain the weight back. So it's really more of a chronic drug, like a high blood pressure drug, really. You take it long term. And those are fine, but again, I would advocate for modifying diet and making sure that you're addressing all the lifestyle factors, so that maybe those drugs, weight loss drugs, can be used to kind of reset the system, and then you lose the weight, and then you're eating healthier, and you've improved your diet, and that way you can keep the weight off. Next pillar is control your cholesterol. So it's important that all adults know their cholesterol numbers. LDL is the bad cholesterol. That's the one that we want to be low. HDL is the good cholesterol that has a protective effect. You may have seen in the news, there's a lot of information coming out about different cholesterol particles, something called LP(a), which is a cholesterol particle that's not measured in the normal standard cholesterol panels, but we're learning that it's one of the most atherogenic, meaning causes more plaque. And so it's a particularly dangerous one to have. So your cholesterol numbers, Some people need cholesterol medicine to bring their numbers down, especially if they have a history of heart disease. Some people can manage their cholesterol with diet. Again, gets back to the pillar of eat healthy, right? So if you're eating a whole food plant-based diet, which is the diet that I advocate for, you're not eating any cholesterol with that. We get cholesterol through eating animals and animal products. So things like meat and chicken and cheese and milk, so dairy milk. The other pillar is manage your blood sugar. So again, this gets back to the point that diabetes is a strong risk factor for heart disease. So if you do have diabetes, it's very important that you control your blood sugars through a combination of medication and diet. And then the last American Heart Association pillar is manage blood pressure. So again, it's important for adults to manage their blood pressure, know their blood pressure numbers, and manage their blood pressure. These guidelines change every few years, but current guidelines, we want blood pressure top number less than 120 and bottom number less than 80. So these are what we call the American Heart Association Life's Essential 8. So again, top of mind, so we can work on those 8 pillars and try to avoid heart disease. Or if you've had a problem with your heart, we want to prevent another problem, right? So that those things are just as important. So here's a question. How does a plant-based diet, like a vegan diet, impact heart health? And what are your recommendations for someone considering this dietary change? Right. So again, I advocate for a whole food plant-based diet. I'm vegan myself for many reasons, but it's, time and again, studies have shown that people who follow a plant-based diet are healthier. They have less heart disease, they weigh less, their blood pressure's better controlled, their blood sugar's better controlled, and they have less certain forms of cancer. There's a documentary out now that's really good that I would recommend people watch. It's on Netflix, You Are What You Eat. And it's a twin study, follows out of Stanford. So they took twins and they randomized one twin to a healthy omnivore diet, so a healthy meat eating diet, and the other twin to a healthy whole food plant-based diet. And, the results are striking. People who, even in 8 weeks, the twins who followed a healthy whole food plant-based diet, they lost weight, their blood pressure's better, their cholesterol numbers are better. So it's a very healthy way to eat. So someone who wants to make that change, it's hard, right? Because diet is so, in our society, it's related to a lot of things. It's cultural, it's food is how we socialize a lot of times. And so it really, and it's hard to be vegan from a personal standpoint. I can tell you, it's hard to eat out when you're vegan. It's hard to travel when you're vegan, because you really have to make an effort to find healthy food. So it's just, it's a lot easier for people to drive through McDonald's. And that's the problem. So, I think we are making some strides in that regard. But for someone who's interested in changing their diet, a lot of people like to do it kind of slowly over time, maybe this week you add vegetable to every meal. And then maybe next week you add a whole grain every day. So it's a way to sort of experiment with different foods and try different recipes. I tell my patients a lot of times that, people who love meat and don't think they can do a plant-based diet, just start with a meatless Monday. So on Monday, instead of making your tacos with, chicken or ground beef, use a plant-based ground crumble or beans and rice, brown rice. So just starting out slow, maybe for some people, is the best way to do it. Other people dive right in and just one day they're vegan. But people are different, so whatever works best for you. There's Dr. Greger, Michael Greger, has an app called The Daily Dozen, and I recommend people download that app. And it's 12 things. They're all plant-based. He advocates for a plant-based diet. 12 things. If you eat every day, The Daily Dozen. That may be the name of the app, The Daily Dozen. You keep track of all the things you're eating and you check them off, and that's a way to sort of, again, think about your diet and work on modifying your diet. There's a question that came, what about cheese? Cheese is very high in fat, and it's very high in sodium, which most people don't realize. So it's not a healthy food. Cheese actually has some properties that stimulate the morphine receptors in the brain. So you hear people that say, oh, I'm addicted to cheese. Well, they may actually be a little bit addicted to cheese. It stimulates areas in your brain associated with addiction. So again, there are some plant-based cheeses, and people think that's weird, but you could try just experiment with different cheeses, plant-based cheeses, but cow milk cheese is not healthy, so I wouldn't recommend that. Let's see. What about a cheese lover like me? Well, maybe you'll become a brown rice lover. So again, it's just, I try to tell people not to think about what is being restricted, right? Because that's sort of the depressing way to look at it. Oh, I'm never going to be able to have cheese again, and I love cheese. So I would look at it, try to shift your mindset more toward, I'm going to eat all these great healthy plants and all this stuff that grows out of the ground and that nature's provided, and I'm going to feel so good, and I'm going to be so much healthier. And I can be mindful of everything I'm putting in my mouth. Where did it come from? Did some creature have to die to make it possible? Did it grow out of the ground? Is it in its most natural form? Now, does that mean you're never going to eat a chip again or some candy? No, that's not what that means. But it does, the more you pay attention to what you're putting in your body, the better you'll do, I think. Because again, sometimes we just do things out of habit or, ease. It's easier to go through the drive-through, or it's easier to make the meatloaf that you've always eaten, or grab the cheese out of the refrigerator just because you like it and that's what you've always done. But again, if you sort of change the way you're thinking about food into more of, my body's a temple, and I only want to put things in my body that are helpful and that are going to be good for me. It's kind of a different way to look at it, and it makes you feel better, I think. So try that, see if that helps. The other thing I wanted to talk about is, so I kind of think of myself, I describe my practice as modern cardiology, meaning I integrate different things. So my focus is not just on taking care of you when you've had your heart attack, but helping you prevent your heart attack in the first place, right? So all those things that we can do before you have some catastrophic event, right? So again, that's these things that we're talking about. So I think of it as, because American medicine is very good at treating the heart attack, treating cancer, treating pneumonia, the acute event, but our healthcare system is not as good at prevention. And it's due to a lot of factors, the historical, the way our medical system was set up, and it's due to the way that health insurance pays for some things and not others, and the way that most doctors are paid. It's for doing things, procedures, and less for the prevention. So it's a multitude of factors, but it doesn't focus on the prevention part. And I think we're learning that the prevention part is the most important part. Again, it's a lot easier to prevent a heart attack than it is to treat the heart attack and all the consequences afterwards. Maybe it's open heart surgery, or maybe it's, you get a stent and then you need another stent in a few years. And so again, if we sort of switch our focus more to prevention, I think it's going to be much more helpful. So again, I'm focusing on what I call as modern cardiology. So it's kind of a conglomeration of different things. It's a fusion of lifestyle medicine and functional medicine. So it's using all the things from these different disciplines to put it all together to help people be their healthiest. Because that's the other important part of it, is we not only want to prevent these chronic diseases because of the way they affect us now, so preventing diabetes and high blood pressure and a heart attack and cancer, preventing them now, but the other part of it that we don't want to forget is we want to age in good health, right? So we want to be 80 and we want to feel good. We want to be 90 or 100 and we want to feel good. We want to be able to, chase after grandkids or great grandkids. We don't want to live our last 20, 30 years with chronic illnesses that limit what we do, right? So it's important to focus on this healthy lifestyle that not only prevents heart disease, but also prevents all these other chronic illnesses, so we can age in good health. So the pillars of lifestyle medicine sort of overlap somewhat with the American Heart Association pillars, but I thought I'd mention those so you can see how it's all kind of the same message. So the lifestyle pillars are whole food, plant-based diet, regular physical activity, stress management. So they incorporate that piece, because again, stress is a huge problem, especially in our modern life. We're all busy, we're running around, we're worried about money and our jobs and pandemics and our kids and it's tough. So we have to figure out how to live this modern life with our prehistoric brains, where we're not used to all this information, right, coming in at the same time. So how do we do that? So stress management, there are lots of ways. Meditation is great. Yoga, any sort of mindfulness-based practice that take us out of the chaos and more into calm, right? We know that stress increases certain hormones in the body that are linked to inflammation in the body, and that inflammation causes a lot of diseases. Autoimmune diseases, heart disease. Inflammation is what makes plaques in the heart rupture and cause acute strokes and heart attacks, and all that is related to stress. So that's an important pillar to work on. I think here's a question about stress. How does stress make my blood pressure high? Well, that's a great question. So again, stress activates these hormones in the body, and those hormones, you've heard of some of them, cortisol, and the stress kind of fight or flight hormones, the hormones that used to keep us alive when we were running away from tigers. All those hormones can increase blood pressure. And again, over time, if you're stressed every day and, those hormones have an effect on the body, and that can make your blood pressure high. So things like meditation has been shown to lower blood pressure. Really any form of stress management, journaling is good for stress reduction. Write in your journal every day. Practicing gratitude has been shown to lower stress and blood pressure. So every day, think of 3 things that you're grateful for, either in your mind or write it down or say it at the dinner table. All those things help with stress. The other pillar in lifestyle medicine is restorative sleep. So again, healthy sleep is important. Social connection. So I don't know if you've heard of Blue Zones. That's something Dan Buettner. That's actually a documentary on Netflix as well, How to Live to Be 100. So Dan Buettner is a National Geographic reporter, and he's traveled the world for 20, 30 years looking at places in the world where people live the longest. And these are called Blue Zones, and there are 5 or 6 around the world. And these are places where people live the longest. And one of the things that is central to that longevity, and they live the longest in good health. So one of the things that is central to that longevity is social connection. So, multi-generational homes where the mom and dad and the kids live with the grandparents. So that helps not only the kids learn from the grandparents, but it helps the grandparents stay active and age in good health. Social connections in the community with your family, things like this where we talk to each other about health. It's been shown that people who hang out with healthy people become healthier. So again, it's sort of your group. You've probably heard the saying that the people that you spend, the 5 people that you spend the most time with have the most influence on your life. And that can be for negative, but also for positive. So, join some groups in your community or online groups, focused on the things that you enjoy, and that helps keep you young and healthy. And then the last pillar of lifestyle medicine is avoidance of risky substances. So again, no smoking, no vaping, don't smoke marijuana, alcohol. That's an interesting one, right? Because for a long time, heart doctors used to tell their patients to have a glass of wine or two at night. I don't recommend that, and I think that is changing. The more data, turns out the data on red wine in the heart was a little iffy. And the negatives of alcohol are so great. I'm sure we all have personal stories of friends or family members, start out with one glass of wine at night and then it's a bottle, right? Alcohol has effects on the brain. So again, if you're trying to age in good health, alcohol is probably not going to help you do that. Falls associated with alcohol, liver disease associated with alcohol. So again, I think as you're trying to be more mindful of what you're putting in your body, I think alcohol would be something that would probably not be something that you would do. How does sleep affect heart health, and what are your recommendations for improving sleep quality? So we know that sleep is very important for heart health in multiple ways. So there are a number of, the main sleep problem that affects the heart is sleep apnea. So sleep apnea is where when we sleep, the back of our airway, back of our throat relaxes, and in some people the airway can collapse, and so you don't breathe well during sleep, and it causes multiple things. So it can sleep apnea can then airway obstruction could cause the oxygen level in your blood to fall. That's been linked to, of course, you don't get good restful sleep when you have sleep apnea. Sleep apnea has been linked to abnormal heart rhythms, difficulty losing weight, elevated blood pressure. So for the lady who asked about blood pressure, sleep apnea can make blood pressure more difficult to control. It can affect, it's linked to congestive heart failure. So sleep apnea is a very important thing for heart doctors to look for. And, we can do either in-lab or in-home sleep tests to check for sleep apnea. Treatment is usually CPAP, which is a device that blows open the airway so you can get normal oxygen. There are other things that we can use, but for most people, CPAP is the treatment of choice. So how to get good sleep. So a couple of suggestions on that. For good sleep hygiene, I tell people, go to bed around the same time every night, and get up around the same time in the morning. So let's say you're shooting for 7 to 9 hours of good quality sleep. So that's what we need. Most Americans don't get their 7 to 9 hours, which causes other problems. So if we're going to shoot for 7 to 9 hours, let's say you get up at 6 in the morning. So then that means you want to be asleep at 10. So then say an hour before that, so at 9 o'clock, you're going to start your winding down routine. So just kind of like if you have children, how you start sort of getting them ready for bed. You don't just throw them in bed and they fall asleep. You you have a sort of routine that you do. So same thing for ourselves. That's what we need to do. About an hour before you want to be asleep, you shut off your screens because that blue light from screens disrupts our sleep cycles. So you shut off your screens. You have some routine that you do. So maybe you take a warm bath, or you wash your face and brush your teeth. You set out your clothes for the morning. So whatever this routine is, you journal maybe, you read a book, something that tells your body, your brain, to start winding down. So to start relaxing, maybe you meditate, do some gentle stretches, something that tells your brain, okay, it's time for me to start dialing it down, start getting into my sleep mode. And then you find if you do this enough and get into this pattern, that by 10 o'clock, then you are sleepy and you're ready to go to bed. So your room should be this dark, cool den, right? So white noise often helps people. So some sort of background noise. Comfy, you want a good mattress, and you want good pillows and good bedding. All that's important. So you're making a cozy sleep environment. A lot of people sleep with their dogs and their cats, and it disrupts their sleep. So you have to be careful with that. Some people sleep with their partner, that disrupts their sleep. So sometimes maybe sleeping separately helps your sleep. So they're just, you have to kind of figure out what works for you, but sort of getting in that habit, dialing things down in the evening, really making sleep a priority. Don't start something if you want to be asleep at 10, don't start watching a movie at 9 that's gonna rev you up or excite you or get you sort of on edge, which brings up another point, no TV in the bedroom, right? So your bedroom should just be for sleeping. So it's your sleeping place. No heavy meals before, late at night. Again, alcohol disrupts our sleep pattern, so I would avoid alcohol at night. Anything that kind of revs up the system, you don't want to be doing when you're trying to go to sleep. Here's a question. What other than statins can help cholesterol, which may be hereditary? Trying to watch my diet. Right. So, sometimes high cholesterol is hereditary. There are certain genetic syndromes that run in families that cause high cholesterol. Again, often cholesterol is related to what we're eating. So you say you're trying to watch your diet. So again, I would try to move toward a whole food plant-based diet. So cutting out meat, dairy, eggs, cheese, all that. Omega-3s are good for cholesterol. You could add those. I recommend that really to everybody, take an omega-3. It's good for your brain health too. There are some supplements. The data on those is not great. So really, I would tell you that diet would be your main way to tackle cholesterol. Often women, when they go through menopause, their cholesterol goes up. So that's something to be aware of. Prior to menopause, women's risk of heart disease is low. but then after we go through menopause, it's equals that of men's, even a little bit higher sometimes. So it's important, even if you had low cholesterol pre-menopause, make sure that your doctor checks it after you go through menopause to keep an eye on your numbers. Let's see. The other thing, speaking of cholesterol, the other thing that I should mention is that even though heart disease is #1 killer of men and women, there is no routine screening for cardiovascular disease, meaning, how we get mammograms or colonoscopies or fecal blood tests to screen for breast cancer and colorectal cancer. There is no screening test that insurance pays for to screen for cardiovascular disease, which is a huge problem, really, because back in the day, sure, all we could do was wait till people had their heart attack and say, oh yeah, you had a plaque somewhere and it ruptured and you had a heart attack. Well, it's not really like that anymore. Again, we can follow cholesterol. We can check these different cholesterol particles, LP little a, ApoB. We can do screening tests. Again, your insurance isn't going to pay for them, but things like carotid intimal thickness, so it's and carotid Dopplers, an easy ultrasound test of the neck that looks for plaque, looks for thickening of the carotids, which is associated with blockage in the heart arteries. So again, it's kind of all related, right? Vascular disease in one artery, like the arteries in the neck, is associated with vascular disease in other places, like the arteries in the heart, the legs, PAD, you may have heard of that. But it's all the same process, right? It's cholesterol plaque and inflammation that causes these plaques to develop and rupture. So there are other screening tests for cardiovascular disease. You may have heard of a CT calcium score. So that measures calcium in the coronary arteries. You get a little radiation exposure with that test, and that one, again, your insurance isn't going to pay for that. But we know that people with an elevated calcium score have increased risk for strokes and heart attacks. So it can help put people into risk categories. If you've already had a heart attack or you're at already very high risk based on other risk factors, sometimes we don't check that because we know you're at high risk. But maybe for, say, a middle-aged woman who her cholesterol is borderline, she doesn't really have any other risk factors, but she's trying to figure out if she should take a statin or how aggressive to be with her cholesterol. If we send her for a CT calcium score or a carotid Doppler and we find evidence of plaque or calcification, then that would tip us into being much more aggressive. So that's how those screening tests help. Because again, we do have ways that we can look and find evidence of plaque before waiting until somebody has their heart attack. Can we take daily vitamins? Yeah, so, right, so, there was a study that came out a couple months ago, maybe longer than that, time flies, but a study that came out recently showing that people who take a multivitamin every day have lower risk of dementia. So yes, I recommend people take a multivitamin every day. Hemp hearts are good. Hemp lowers, is a good source of, it's anti-inflammatory and it's a good source of omega-3s. So those are good for the heart. So, you know, you can add hemp to your salad or your oats or other oatmeal. It's just something that you can sprinkle on. I also recommend a tablespoon of flaxseed every day. So flaxseed, again, is a good source of omega-3s. You can sprinkle that on your oatmeal, on your salad, mix it in a smoothie. That's good for you. So as far as things to take every day, I recommend to my patients a multivitamin every day. D3, right? That's good for our bones. Magnesium, good for the brain and good for the heart. What else? Omega-3s. Again, you know, omega-3s, often it's from fish oil. So I'm vegan and I don't want the fish oil. So they do make a vegan omega-3s that come from algae. So, and those are just as healthy. And then, seems like I'm missing something. So magnesium, D3, multivitamin, omegas, and let's see. Oh, B12. Yeah, B12. B12 is good. You know, if you're vegan, you have to take B12 because the only place we get B12 anymore is through meat. So if you're vegan, you need a B12 supplement. Most people think that every adult should take B12. It's good for the brain too. So that's the other one I recommend every day. Let's see. How long do you have to wait to get your teeth cleaned after stents are placed? That's a good question. I don't know if there's any standard guideline on that. I usually tell people, you know, so if you're having your teeth cleaned, that's an elective thing, right? So I would probably wait a couple months just because. Here's a question. My heart keeps releasing troponin in a constant stream that makes my heart have an episode. How can I stop the troponin? So that's kind of a, you know, I think there are more parts to that, to your particular scenario. There are a lot of things that can make troponin elevated other than the heart. You know, troponin is just for other people that may not know, troponin is a blood test that we measure to look for heart damage. So like, let's say you go to the ER with chest pain and they draw all that blood. One of the things that they're checking is troponin. So heart attacks can elevate troponin. Inflammation of the heart can elevate troponin, but other things can elevate it too. You know, if someone has a seizure, sometimes their troponins are up a little bit. If someone's kidneys don't work right, it doesn't process the troponin and it can be elevated. Some bowel problems can cause elevated troponin. So I guess, you know, the troponin is released from the heart, but it's not really the problem. It's showing you that there is a problem. So I guess the question I would have you ask your doctor is, you know, why is your troponin high? Really, that's what you need to get at with an elevated troponin. All right. What other questions? Just scrolling through here. So the other, I'm trying to think of some other good resource. Oh, the other thing that's interesting that we're learning more and more about is sort of this gut, the gut microbiome, and how the gut affects everything, really. But you know, gut brain health, gut heart health. Things that you wouldn't necessarily associate with the gut. We're finding out more and more that these things are important. So, you know, the gut is full of trillions of bacteria. The gut microbiome is what that's called. So, you know, all the bacteria that live in our gut, that it's a symbiotic relationship, right? So we help the bacteria and the bacteria help us. So we're learning more and more about how important these bacteria in our gut are. And again, things that disrupt the gut microbiome have effects on all this other stuff. So, you know, antibiotics that you have a cold and you go to your doctor and you get antibiotics for your cold. So that wipes out your gut microbiome. Antibiotics in animals. So factory farming injects all those animals with antibiotics. Actually, they're the biggest consumer of antibiotics. All those, and then we eat that meat, and that disrupts our gut microbiome. The standard American diet, so this SAD diet that I talked about, all the processed foods, the white flour, the white rice, the fatty foods, the all these things disrupt the gut microbiome. So what happens is the gut microbiome becomes, the good bacteria become less and the bad bacteria become more. And it disrupts all the things that the gut is related to. So it disrupts gut-brain connection. The gut, it's thought that a lot of the chemicals in meat cause inflammation through this derangements in the gut microbiome. So again, you know, a lot of diseases and conditions that you wouldn't think were associated with our gut, some of that may be the connection of how our crappy diets are causing so many problems. So again, another reason to be more mindful of what you're putting in your gut. So what are the most common misconceptions about heart disease in both men and women, and how can we address the misunderstandings? So I think probably two things, and I've touched on them before earlier in the talk, but I don't think that most women understand that heart disease is the #1 killer of women. I think most women may think it's breast cancer, but it's not. Heart disease is much more common and much more deadly than all those things combined. So just the awareness of that, I think, is important, because again, you know, we can't learn about something and figure out how to change something if we don't understand it, right? And we don't realize it. It's a problem. So being aware that heart disease is the #1 killer of women. And I think the other misconception that people have is that, you know, that it's just genetics, and my dad had a heart attack when he was 60 and I'm just doomed. It doesn't matter what I do. You know, that's my fate in life. And again, we know that most cardiovascular disease is not, is only the small minority of cardiovascular disease is genetic. So it's like 10%, 20 at most. So 80, 90% is lifestyle choices that we make every day, or don't make, that increases that risk. So, and the good news about all these things, these healthy lifestyle things that we're going to do to improve our heart health, are good for all the other things too, right? Because it's all related. The pillars of lifestyle medicine, the whole food plant-based diet, the increased regular physical activity, the stress management, restorative sleep, social connection, avoidance of risky substances, maintaining an ideal body weight. All that stuff not only prevents heart disease, but it prevents cancer, it prevents diabetes, it helps us maintain an ideal body weight, it helps us, it prevents Alzheimer's, it helps us age in good health. So again, it's all related. So, it's not like you have to do this set of things for this disease and this set of things for this disease. If you follow a healthy lifestyle, it attacks all that stuff. So that's the good news. Debate on eggs, okay or not. Yeah, so eggs, it goes back and forth with what you hear and what you read. Again, I advocate for a whole food plant-based diet, and eggs aren't part of that. And eggs have cholesterol. Dr. Michael Greger, his site is nutritionfacts.org. And he's a great resource for all things about nutrition. And he goes through the different studies on eggs, and he says no to eggs, and I advocate for that as well. You hear people always say, the next question, well, how am I going to get my protein? People always think that if they're plant-based, they're not going to get enough protein. And that's not true. In modern society, we all get enough protein. And a lot of plant-based foods have a lot of protein. You can look up the milligrams, but all your nuts and seeds and whole grains, quinoa, all those. If you eat a well-balanced whole food plant-based diet, you'll get plenty of protein. There's a documentary on that called Game Changers. Again, I think that's on Netflix, about elite athletes who are plant-based. And they talk about that aspect, and they do fine. The doctor, it's Dr. Michael Greger, Greger, and it's nutritionfacts.org. And again, he's a great resource. What else? I guess I'll talk a minute while I'm waiting on another question. Talk a minute about secondary prevention. So, again, so I practice modern cardiology. So we're preventing heart disease, right? Hopefully to prevent you from ever having a heart attack or stroke or heart failure or any of AFib, any of it. But sometimes, no matter what we do, people have cardiac events, right? So it's still, again, the number one killer of men and women. So some people are going to have heart attacks and going to have AFib and going to have high blood pressure. So then they're going to have high cholesterol no matter what they eat. So then that's secondary prevention, right? So how do we prevent, if you have something, let's say you've had a heart attack, how do we prevent another heart attack? So it's not just, well, you've had a heart attack and you got a stent, or you had open heart surgery, and here's your cholesterol medicine and your aspirin and your blood pressure medicine. and, you know, this pocket full of pills you have to take. But don't forget the lifestyle stuff is still very important for those people too, right? Because it's not just the pills, it's that the prevention part, the secondary prevention is we want to help you avoid a second event. So the pills are important, certainly in some cases, but we also have to tackle the other part of it, the lifestyle pillars of it. And that's all these same things I've been talking about. You know, sometimes we forget that people, after people have had a heart attack, we have to focus on all the lifestyle stuff as well, because that stuff is very important. So it's primary prevention, preventing your first event, and then secondary prevention for people who've already had an event. Sorry. Can everybody bake their bread at home? No. You know, a lot of people don't have time to do that. But again, it's a spectrum. So there are ways to choose better bread than others. So Dr. Greger in that nutritionfacts.org, he has a rule of thumb that he goes by that I find very helpful as well. And it's, so you look on the back of your package of your bread and you see the total carbohydrates, say 20, and then you see the total fiber, say 2. So 20 divided by 2 is 10, and he uses 5 as his cutoff. So you want to get below 5. So just pay attention. Next time you go to the grocery store, turn your bread around and do that quick calculation. Total carbohydrates divided by fiber, and you'll see that most breads don't get you down to that below 5 or below. Dave's Killer Bread, that's what I use. That's close. Hit the Power Seed bread is good, and that'll get you below that 5. But if you look at most breads, you know, they have a lot of sugar, they have a lot of preservatives, right? That's how they stay fresh for a week or two. So you just have to kind of learn how to read your labels. Again, nutritionfacts.org, he's a great resource for just those general tips about nutrition. So that's, you know, that's how bread, in general, bread's not good for you. You know, so I would tell you to try to avoid bread. But if you are going to eat bread, try to get it more fiber, as you can. What are my views on statins? Well, you know, statins are one of the, if not the most prescribed drugs in the world. They've been out for a long time. I've been a cardiologist for 25 years, and they've been out the whole time I've been a cardiologist. Some people need statins. You know, statins is one of those drugs that everybody seems to know about, and they always read a bunch of bad stuff on social media or you know, in publications about statins. I've prescribed statins for a long time. I can count on probably one hand the number of bad side effects that people have had on statins. So I prescribe them a lot as a cardiologist. You know, most of my patients are on them. Now, again, does that mean, again, you know, that's for secondary prevention, right? So again, I'm seeing a skewed population. So I'm seeing people most of them have already had a cardiac event. So for those people, we know that statins prevent a second event. Now, the data for primary prevention is not not as strong. So, do statins need to be in the water? No. Does everybody need to be on a statin when they hit middle age? No. You know, so for primary prevention, meaning someone that hasn't had a heart attack, we use what we call a risk calculator. So you can Google this. The American Heart Association risk calculator. So it puts in different things that you have. Do you have diabetes? What's your blood pressure? Are you on blood pressure medicines? What's your cholesterol? What are your numbers? And it gives us a risk score. So for people who are at high risk, sometimes we use statins for primary prevention, meaning someone who has a ton of risk factors and their cholesterol numbers are horrible. Yes, then we might put them on a statin. Again, we're doing it hopefully in conjunction with advocating for a healthy diet. But sometimes people need statins. Side effects of statins, the one that we worry most about is muscle breakdown. And if that's severe, it can sort of clog up the kidneys. It goes away when we stop the statin and we flush the kidneys. So usually, it's not a long-term thing. There can be some elevation of liver enzymes on statin therapy. It's never been linked to liver failure, but just asymptomatic elevation of liver enzymes, and that's why we check blood tests when you're on a statin. Statins have been linked to increased small but real increased risk of developing diabetes when you're on statins long term. It's a little hard to tease out because a lot of people that get put on statins also have risk factors for diabetes, but nevertheless, I think it is a real thing. So that's something to be aware of. Sometimes people have nightmares on statins, so that's something to be aware of. And then the other thing, sometimes people have a kind of a foggy-headed feeling when they take statins. Not been linked to any long-term memory problems or brain issues. In fact, most studies show that statins decrease risk of Alzheimer's. But anyway, just something to be aware of. And if you stop the statin, that foggy-headed feeling goes away. And then muscle pain, not the severe muscle breakdown, but some people do experience muscle pain and fatigue when they're on statins, and that causes us to have to stop it, and that those symptoms go away when the medication's stopped. If someone's due for near hip surgery, what would the risk be of not coming off aspirin? Well, bleeding is the risk of not coming off aspirin. So usually when you have major surgery, even minor surgery often, your surgeon will want you to stop aspirin. And because aspirin thins the blood, if you don't stop the aspirin and you have the surgery, then you can have bleeding, post-op bleeding, and that can be a problem. If you've had a stent, your cardiologist will want you to wait a certain amount of time before you can have an elective surgery, because they don't want you to come off your blood thinners. But again, if you've had a stent, you need to talk to your cardiologist about that. But definitely, if your surgeon wants you to stop the aspirin, they want you to stop it because of the risk of bleeding. Somebody's asking, are most medications stopped after 1 year and no further heart episodes? Again, that's a tough one to answer because I don't really know, that's a broad question. So some heart medications are continued forever, right? So if someone's had a heart attack, we put them on a statin and to lower risk of second events, and they have to stay on that forever. People who are on blood pressure medicine often have to stay on their medicines forever unless they drastically change some things, and their medications can be tapered and stopped. If you have AFib and you're on a blood thinner for AFib, sometimes you have to take that forever. So it just depends on what your particular cardiac diagnosis is, how long you have to stay on your medicines. So, but certainly I wouldn't stop any medicines unless your cardiologist says that's okay. All right, what else? So we have about 15 minutes. Trying to think of some other good resources. There's that Dr. Greger, Michael Greger, has a book called How Not to Die is the name. And he has a new one actually, How Not to Age. So those are good resources. Dr. Dean Ornish, he is a cardiologist. He was one of the original cardiologists back 20 some years ago who showed that lifestyle changes can decrease blockages in the heart. So he would do an angiogram, so where we go up in the heart and shoot the x-ray dye and take the pictures, do an angiogram on people at baseline, and then he put them on a whole food plant-based diet. They did regular exercise, stress management, social connection, all those pillars of good health. And then he redid their angiogram a few months later, and he showed regression of plaque. So plaque can actually get smaller with all these lifestyle things that we're talking about. So, again, I think that's good news, right? So it's not just medications that lower our plaque and lower our risk, but lifestyle. So, maybe instead of your doctor writing a prescription for Lipitor, they'll write you a prescription for plant-based diet and exercise and good sleep. So again, emphasizing that all those things are just as important and all those things help. What are the most important lifestyle changes you recommend for someone looking to prevent heart disease, and how can we implement those changes starting today? So I would start with working on your diet and getting better sleep and moving more and cutting back on any risky substances. So again, don't smoke, don't vape, don't cut back on your alcohol. I would try to cut back to none, and don't smoke marijuana. Those things aren't good for your heart. Follow a whole food plant-based diet, get good sleep, and be more active. Those blue zones people, they don't go to the gym for 30 minutes or an hour 5 times a week, but they're more active. They move naturally. So they move around the house, right? They're not sitting watching TV for 3 hours in the evening. They're cleaning the house, or they're gardening, or they're, the Japanese people in Okinawa, which is one of these blue zones, they don't sit in chairs. They sit in cushions on the floor. So they have to get up and down and up and down. And it's good for your back. It's good for your hips. It's good for your posture and your balance. So think of ways to, if you hate to go to the gym, like me, think of ways to move other ways. So maybe you'd try, you do yoga for 20 minutes one day, and the next day you go for a walk, and the next day you do qigong. Maybe the next day you do Tai Chi. So just, try some different things. Maybe something resonates with you more than something else. So just kind of experiment with different things. Again, these days we can find videos on YouTube or, the internet, and explore some different things and different ways to move, that you might like better. So, try that. Let's see. How can your calcium score be lowered? Well, that's an interesting question, actually, because statins actually increase people's calcium score. So you may think, why is that? And what does that mean? We know that people who are long distance runners, extreme athletes, have higher calcium scores, but they don't have a higher risk of heart disease. So what's the connection? Well, so think about the calcium score. The calcium score measures calcified plaque, so hard plaque. So there's another type of plaque called soft plaque. That's actually the worst kind of plaque. So soft plaque means plaque that's inflamed. That's the type of plaque that's more likely to rupture and cause an acute event like a stroke or a heart attack. So if you're going to have plaque, you want it to be hard plaque. So how can you lower your calcium score? Often we don't see it lower as much as we don't want it to continue to increase over time because of poor lifestyle. Now, if your calcium score is increasing because you're on a statin or you're an extreme athlete, that's a different sort of bucket. But if your calcium score is increasing because you're eating crappy food and your diabetes is out of control and all those poor lifestyle factors, then that's a different story. So again, we want to practice good lifestyle habits. That's what's good for your heart. How many stents are too many before a bypass is recommended? Well, it's not really, it's not a specific number of stents. It's more where your stents are and what's happening with your stents. So, people can have 10 stents. Let's say, 2 in this artery and 4 in this artery and 2 in this other artery, and they do fine, and their stents stay open, and they're trying to work on their lifestyle factors, and they're taking the prescriptions they're supposed to take, and your stents are open and fine, then you don't have to have bypass surgery. But sometimes maybe one of those stents gets blocked off, or you have another blockage in another artery that maybe can't be fixed with a stent. Then sometimes, or it's in a place that can't be reached with a stent, then sometimes bypass surgery is indicated. But there have been studies that they took people with who'd had bypass surgery and even repeat bypass surgery and couldn't have any more bypass surgeries. The surgeon said, "We can't do anything else for you, sorry." And they put them on lifestyle regimen, all these things that I've been talking about now for almost an hour and a half: whole food, plant-based diet, stress management, regular exercise, good sleep, and that people get better. They don't need they don't need any more stents or surgeries. They do fine and they live a long time. And so that's again, that's my message. That's the thing of all the stuff that I would want you to take home from this, is that, you know, you're not doomed, whether it's you have a strong family history of heart disease, or you've already had a stent, or you've already had 10 stents, or you've already had bypass surgery. That doesn't mean that you're doomed to die of heart disease. You can have stents and you can turn things around and you can live a long, happy life and die of something else when you're 100. So that would be my hopeful message to get out there. Let's see. Stuff to take for good sleep. You know, I don't, you know, some people take melatonin for sleep and they say that's helpful. I think melatonin is probably okay. But again, I advocate for that good sleep hygiene stuff, the winding down, no screens, no TV in the bedroom, cool, you know, a routine that gets your brain ready for sleep, no heavy meals, no smoking or drinking before bedtime. So just a nice, relaxing environment that helps you get ready for sleep. Let's see. Calcium score increases as soft plaques calcify and turn to hard plaques. That's right. So again, hard plaques are less likely to rupture. And that's also why we're running out of time. But, you know, people can have a calcium score of 0 and have a 99% blockage in one of their heart arteries. So that's the downside of a calcium score, right? It just looks for hard plaque. And I've seen patients, their calcium score is 0, they have a 99% LAD lesion, and they need a stent, they're having chest pain. So just because your calcium score is 0 doesn't mean you can throw caution to the wind and eat a steak every day, right? So again, I would still follow these lifestyle pillars. That's where, so it's, again, calcium scores, good screening tool. The other test that's easy and good to do is a carotid ultrasound, carotid intimal thickness. Yes. Esselstyn, Dr. Esselstyn, that's his diet, where he took the patients that couldn't have redo bypass surgery. So we have about 3 minutes left. So there are a lot of great resources, all these things I've mentioned and I've talked about. Maybe I'll put a list of these resources, or you can email me, Dr. Tracy at hearthealth.care, and I can send you, I have a list of resources that I send to my patients. I can send that to you. Check out my website. You know, I have links to I have online courses that people can take, learning these foundations for health, more of a guided course. I have a 12-week course and I have a 52-week course. It's an awesome, you know, once a week I send you information. You meet with health coaches. It's an awesome natural health immersion. I see people in consultation too. I'm licensed in several states. I also do health advocacy. So, you know, sort of if you have a question and you just need somebody to sit down with you for an hour and go over, your medical condition and what you have, and make sure you're heading in the right direction. I can help you with that. So I have a lot of things to help people. Again, my goal is to educate people about heart disease and help you prevent heart disease, and I have a lot of resources to help you do that. I have a weekly newsletter that I send out. I have a podcast where I give little 1 to 2 minute health tips 3 times a week. I have, what else do I do? I can send, if you're not a podcast person, I can send those health and wellness tips directly to your inbox. So I have a lot of resources. So again, if you'll just shoot me an email, Dr. Tracy at hearthealth.care, I can get you that information and send you those links and get you signed up and help you prevent heart disease. So I hope you found this helpful. We're coming up to time. If you have any other questions that I didn't answer, you can shoot me an email, and hope you found this helpful, and maybe we'll do it again. Can you please offer to take new patients? Sure. Oh, yeah, sure. Devin, my super assistant, maybe she can help me with that. All right. Well, I hope you learned something, and I hope we'll do one of these maybe next month. Next month's Heart Month, so maybe we could do it again next month. All right. Take care. Thanks.